We figured you needed a break. So we're going to focus on watching cat videos for a bit, and in our spare time, learn a bit about Toxoplasma gondii. So Toxoplasma gondii, or toxo for short, is one of the many microbes that are particularly important to the pregnant and the immunocompromised. It's an intracellular parasitic protozoan that can infect almost any warm-blooded animal. It's estimated that approximately 30% of the world's population carries Toxoplasma. 30%? Well, that's because in the immunocompetent, there aren't many symptoms. So a big buzzword associated with toxo is cats. So our scene's going to take place in the backyard of a crazy cat lady, with all of her little cats having a little garden party. But first, one more cat video. So like I mentioned earlier, pregnant women and the immunocompromised are populations at risk. So we're going to draw our crazy cat lady, who also happens to be pregnant, and she'll be kneeling down about to take a picture. So let me talk briefly about transmission. There are actually several ways toxo can be transmitted. One is that it's commonly transmitted by consumption of raw or undercooked meat that contains toxo tissue cysts. It can also be transmitted via ingesting water or vegetables that are contaminated with oocytes shed in the feces of infected animals. And thirdly, it can be transmitted through the placenta from mother to fetus in utero if the mother is first exposed to Toxoplasma during pregnancy. So there are really three main ways to transmit toxo. One is eating raw or poorly cooked meat. Two is coming in contact with oocytes shed in animal feces. And three is transplacental transmission, as in the torch infection. We'll illustrate all of these eventually as we make our way through the video. Because of this transplacental transmission, pregnant women are advised not to change kitty litter boxes during pregnancy. However, in our sketch, against better judgment, our preggo cat lady is changing the litter box beside her. In one hand, we'll give her a poop scoop with a dollop of cat feces in it. Since there's so many cats at the party, there's quite a collection of poop in the box. Also, we'll add some bird eggs falling in the poop to remind us that it's oocytes, or little toxo eggs, in cat feces that allow Toxoplasma to be fecally transmitted. So again, this is one of the three ways toxo can be transmitted, via oocytes in animal feces, especially cat feces. So we have pregnant women, but the other population that are important to think of when you think of toxo are the immunocompromised, particularly those with HIV. So now we'll draw in our first of her many cats, a poor, wrinkly, sickly cat. He's thin with a white robe thing, and those glasses look familiar. Kind of like the glasses that Gandhi wore. Get it? Gandhi? Toxoplasma gondii? Poor, fragile, sickly Gandhi is holding a cane to remind you of the immunocompromised state. And now we're going to add some extra lens rings to the side of Gandhi's glasses. In immunocompromised patients, especially HIV patients, Toxoplasma infection causes brain abscesses, seen as ring-enhancing lesions on CT or MRI. Ring-enhancing is definitely a buzzword to remember, and this cat's shiny round multi-lens glasses will help you remember the multiple ring-enhancing lesions that are characteristic of CNS toxoplasmosis. Although Toxoplasma encephalitis can occasionally cause a single brain lesion on MRI, such a finding suggests an alternative diagnosis, like maybe CNS lymphoma. So let's add our classic red encephalitis turban to Gandhi to represent Toxoplasma encephalitis. So what's another way to differentiate CNS toxoplasmosis from CNS lymphoma? It's actually brain biopsy. So we'll show this by putting a big pin sticking out of the turban as if it were a biopsy needle. Also, if our cat's going to be a true Gandhi cat, he at least better be going on a hunger strike. We're making him push aside a bowl of bubbly-looking meat with his foot. This bubbly-looking meat is to represent cysts that could be present in undercooked meat that promotes transmission of the parasite. This was the second type of transmission we talked about. So we have cat feces and undercooked meat illustrated so far. All right, on to clinical symptoms. Again, in healthy people, toxoplasmosis may cause flu-like symptoms, but for the most part, it's asymptomatic. However, toxoplasmosis can be devastating, not only for HIV patients, but also for the fetus during congenital toxoplasmosis. So the T in the torch's mnemonic stands for toxoplasma. So to remind you that it's one of the torch's infections, we'll add a cat dressed up as the Statue of Liberty. The transplacental transmission causing congenital toxoplasmosis is the third and final way toxo is transmitted, and it's illustrated here with this torch. In congenital toxo, there's a classic triad that consists of chorioretinitis, hydrocephalus, and intracranial calcifications. We'll add some more kittens to the party to help you remember this triad. So one of them will be drinking milk, and how cute. Some of the milk has gotten all over his head. So milk on the head in sketchy land equals brain calcifications, just like it did in our CMV video. Another kitten was so excitedly drinking water that the whole bowl got stuck on his head. A big, bulging bowl of water on the head is a perfect representation for hydrocephalus. He's trying to shake off the bowl unsuccessfully, and the shaking, of course, representing seizures. So to round out the classic triad, we'll add another object to our host's camera, a giant flash bulb. But wait, the bulb looks a little odd. It looks awfully like a fundus, but it's grainy with a big mess of something over the retina. This is to represent chorioretinitis. And here's what it actually looks like. And HIV patients with low CD4 counts can also develop chorioretinitis. So our Statue of Liberty cat with a torch representing torch infections is looking over at the classic triad seen in congenital toxoplasmosis. Again, that's intracranial calcifications, hydrocephalus, and chorioretinitis. However, there's another symptom that's not part of the classic triad that I think you should know. And we'll illustrate this by adding another cat that will be dressed like Beethoven. And why is that? Because Beethoven was deaf, and babies with congenital toxo can also become deaf. I wish I could say that Beethoven went deaf from toxo, but he didn't. Oh well. Finally, a couple of practical details. Diagnosis is made by serology or biopsy, in which you would be looking for intramuscular cysts. But remember, just because serology may be positive, it doesn't indicate active infection. Remember, I said a large proportion of the population have been exposed to toxo in the past. So treatment of active infection is with sulfadiazine and pyrimethamine. So to remember sulfadiazine, we'll include our sulfur eggs. But let's dye them this time. That's right, we have some dyed sulfa eggs left over behind the shrubbery from last Easter. This lady sure loves her parties. And we'll put some pyramid shapes on these Easter eggs so you don't forget about pyrimethamine. Alright, last thing. You need to give prophylaxis for HIV patients when CD4 counts are less than 100 and their IgG is positive for toxo. So to remember this, we'll add a final cat, one dressed as Benjamin Franklin with an immunocompromised cane. Why Benjamin Franklin? Because his mug is on our $100 bill. The $100 bill is a reminder for you to begin prophylaxis when CD4 counts are less than 100. But remember, they also need to be positive for IgG against toxo. So we all remember Franklin's famous key tied to the kite that he flew during a thunderstorm, right? So tonight, he discovered electricity for all of cat kind, and that kite's sitting in this bush. The cross on the kite looks like a big positive sign, and the key is a big IgG antibody, representing that he's positive for IgG antibodies against toxo. So let's add in one more egg next to Benji over here, but without the pyramids, since the prophylaxis is actually going to be TMP-SMX, or our classic sulfa egg. So that's all for toxo. Thanks for watching so patiently. Now back to cat videos.